Hi, it's Dr. Hester, and I wanted to come on here and talk to you a little bit about the flu. There's an awful lot of flu going on. I'm sure you know several people who've had the flu or their kids have had the flu. And so I wanted to come on and cover some of the questions we're getting at the office. So the flu symptoms are starts with a little congestion and cough. Then it rapidly, within usually a day or so, will develop into fevers and body aches, fevers that get as high as 104. A lot of these kids currently are having stomach symptoms with vomiting and not wanting to eat. So the unfortunate thing about the flu that makes it so bad is that it can last 7 to 10 days once it starts. And with kids having that much sickness, they're stuck at home, and parents are stuck at home with them, caring for them. So when you think that your child is coming down with the flu, they do need to come in to be checked. I wouldn't say they need to come in and be checked if they have cold symptoms. Just that's kind of a good rule of thumb. If they've got cold symptoms for a couple of days, there's no point in doing a flu test because they don't have the symptoms of the flu yet that you're really trying to prevent. So if they start to develop fever, and I would say above 101, if they start to say they feel achy and they're having stomach symptoms, then we should bring them in and we should test them for the flu. We have some prescriptions that we can give for the flu that can help to shorten the course of the flu. Like I said, that lasts 7 to 10 days. There are some prescriptions. The one that most people are familiar with is called Tamiflu. Tamiflu can really help to shorten the course of the flu down. But you need to start it within the first 48 hours of the onset of symptoms. So I would recommend getting your child tested, and if you want them to get the Tamiflu, then make sure you get them in and get tested and started on that medicine in the first 48 hours. And then they also have got to stay home until those symptoms, the contagious part, the fever and the body aches and their stomach symptoms have been gone for 24 hours before they can go back to school. The tough thing about catching the flu is you'll be out in public and exposed to people that are infecting others but haven't come down with the sickness yet. And that's the tough thing about the flu, and that's why it spreads so much, because it's very easy for you to infect everybody around you when you're just starting to just get the very first few symptoms and you're not even aware that you have the flu yet. So anytime you're out in public during flu season, you need to be assuming that you're exposed to the flu, and you need to be doing everything you can to prevent catching it. And that pretty much means washing your hands, because you're going to be touching flu germs everywhere you go, shopping carts, doorknobs, going in and out of the bathroom, water faucets, at school. So, we've all got to do a better job of washing our hands obsessively, multiple times a day, hourly. And anytime you touch anybody, I would immediately go and wash my hands. People talk about hand sanitizer. I think hand sanitizer is fine. It's probably not quite as effective as washing your hands with soap. There's some concern that it's breeding resistant bacteria, and the Center for Disease Control does recommend you use soap and water in preference to hand sanitizer. But if you don't have access to soap and water and a sink, then it is a good thing to have hand sanitizer. It's much better than nothing. But if you have the flu and you're trying to prevent giving it to everybody else, you need to be sure not to sneeze into the open air, cough into the open air. We talk about using the cough catcher. That's important. But again, hand washing. So if you have one child at home that's sick with the flu, you need to wash their hands, you need to wash your hands, you need to wash everybody's hands. Of course, the most important thing to prevent the flu is the vaccine. Now, I've heard some people who've come in and they've said to me, they've heard the flu vaccine is only 10% effective this year. That was something that was reported in a few news stories that I saw. Unfortunately, those news stories were not accurate. They were trying to summarize an editorial that was written in by some specialists about the flu in Australia, and it didn't really apply to what we're seeing in America. We don't actually have any data that tells us how effective the flu vaccine has been so far. And there is every reason to get vaccinated for the flu, even now. Even though we have already been through an awful lot of flu, it may have already gone through a peak. It may not have peaked yet. It could continue to worsen. Also, there are multiple strains of the flu that come through every year. And there are at least 4 strains of the flu that we see in Gadsden. There are 4 strains in the vaccine that we give to kids to prevent the flu. And so even if your child has had the flu infection and recovered, I would still recommend they get the vaccine. The vaccine is safe. It does not cause problems like the flu itself. It doesn't cause complications. In an overwhelming majority of people, like all other vaccines, I recommend it for all kids across the board. So I would encourage you to come in and get vaccinated. So we have the vaccine. So y'all come and see us, and we'll be here. Thanks.